I'm Liz Bridges. I am an associate professor in biobehavioral nursing at the University of Washington. And my other job is that I am the clinical nurse researcher at the University of Washington Medical Center. I'm a critical care nurse by background, and I'm also a clinical nurse specialist. So my work melds all of those different roles all in one. So I've been a nurse for 30 years, so this has really been a work in progress. But the work that I do here at the school obviously is around teaching and around research, and I study the care of critically ill and injured patients under austere conditions, including in the back of an aircraft being transported halfway around the world. But I think what might be most interesting to you is the work and the relationship I have with the nurses at the hospital. The hospital I work at is a magnet hospital, which is a hospital that has really committed to advancing a culture of inquiry. Our nurses have an expectation to ask why and to use evidence to answer their practice, and my job is to help them with that process, whether it's simply helping them think through a clinical issue, helping them sort out what's the evidence that's available about a particular project, running evidence-based initiatives. So how do we take that evidence, if it's there, and transfer it into practice? If there isn't sufficient evidence, when do we need to do a research study? And so my job is to help them with that, from asking the question to designing the study. And I think the most important part of all of that evidence-based practice or research is asking the question, at the end of the day, how do you know you've made a difference? What are the outcomes of your research or your initiative, or even the care that you are doing at the bedside? Because obviously you're doing it for some reason to improve patient care for the healthcare system. So we take it all from asking that question, why, at the bedside. I wonder why, I wonder how, I wonder if, and then we say, well, what's the evidence? And then we go from there in terms of deciding how that will affect practice. So the research that I do here in the school, I work with many of the nurses who are going back to school. So we sort of cross from the medical center over here to the school and back again. So it's almost a constant loop of what we do. So I have a real broad sort of number of jobs that I do. This reflects my role as a researcher, but also as a clinical nurse specialist, where my job is to really help bring the best evidence to the bedside, improve outcomes for our patients and for the healthcare system. So I wish you well with your studies and your career.